This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Dydetrogyl Tablet is a hormonal therapy used to address progesterone deficiency. It manages various symptoms associated with this deficiency effectively. Indications and uses. This medication is indicated for managing menstrual pain, alleviating symptoms of endometriosis, and addressing premenstrual syndrome. It also plays a crucial role in supporting female reproductive health and mitigating postmenopausal symptoms such as hot flushes, sleep disturbances, and mood swings. How it works. Dydetrogyl Tablet works by improving the thickness of the uterine lining and correcting hormonal imbalances caused by progesterone deficiency. Directions for use. Take this medication as prescribed by your healthcare provider. It is recommended to swallow the tablet whole with a glass of water without chewing or crushing it. Consistency is vital, therefore, try to take it at the same time each day. It can be consumed with or without food, and your doctor will determine the appropriate dosage based on your individual condition. Possible side effects. Common side effects may include severe headaches, nausea, breast pain or tenderness, and irregular menstrual periods. Consult your healthcare provider if any side effects become severe. Precautions and warnings. Prior to starting this medication, inform your doctor about any existing health conditions, such as liver problems, depression, or any history of blood clots. It is also essential to avoid use during pregnancy or breastfeeding unless advised by a physician. FAQs. 1. What is this medication used for? It is used to manage progesterone deficiency and relieve associated symptoms. 2. How should it be taken? Swallow the tablet with water, as prescribed by your physician. 3. What are the common side effects? Side effects may include headaches, nausea, and breast tenderness. 4. Can I stop taking it suddenly? No, always consult your doctor before discontinuing this medication. 5. Is it safe for children? It should be used in postpubertal female children only if prescribed. Thank you for watching. If you have any questions or suggestions, please leave a comment below.